I want to bring in Dr. Nancy Simpkins, an internist and medical advisor for the state of New Jersey. Doctor, good morning.
Good morning, Jose. How are you?
Good, thanks. Let's do some more fact from fiction parsing. So on a day like this is a big story, but on a day like this, bowling alley, where he went to, it's closed out of an abundance of caution. Is that going too far?
You know, Jose, people panic, and we can't fault people for panicking. So what we need to do as medical professionals is reassure people there is no need to panic. I understand the bowling alley being closed. They are going to investigate it. They are going to sterilize it. They're going to use bleach solution, and then it will reopen. I think this is really for the public persona, more so than the fear of actual Ebola virus being at the bowling alley.
You know, it's interesting. I can't tell you how many people have asked me over the past 24 hours, can you get Ebola from a bowling ball? I mean, that's a very, I've heard that over and over again.
Of course, people are really concerned, but remember, Ebola is a difficult virus to get. It has to be in copious amounts of either vomit, blood, or feces. It is not just from touching a surface. It needs to be in a warm body or in a warm fluid. So if he did touch the bowling ball and you touched the bowling ball, the chances of getting Ebola are slim and none. We have not seen any transmission of the virus in this way since 1976 when we've been studying the virus.
Doctor, let me ask you another question that I've been asked 100 times over the past 24 hours as well. When are you contagious when you get Ebola? Is it during the fever? Is it after the fever? Are you contagious before you show a fever?
Well, let's talk a little bit about what the disease means. So as the virus replicates in your body, you develop a fever. So the fever is the sign of high titers of virus. So during that period is when you're shedding a lot of virus. So that's why the fever is significant, because that 103 fever means that his viral count is very high, and that's the time he becomes contagious.
So, just to get, and by the way, they're saying it was 100.3 fever that he had when he called the officials in and when he checked in. So let's just say that, you know, he went the night before to this bowling alley. Before he had any fever, he said he was feeling tired, but, you know, many of us can think that and not have Ebola. So if he goes to this bowling alley the night before, he doesn't have any high fever, could he have been contagious then?
The chances of him being contagious at that point are slim. Can I assure the American public that there is no chance? Of course I couldn't. But that's like saying we're going to cross the street and get hit by a bus. I can't guarantee you're not. What do medical statistics say? Medical statistics say the chances of him transmitting the virus at that point are virtually non-existent.
Dr. Nancy Simpkins, thank you so much for being with me.
Thanks, Jose. Have a good morning.
So important. Likewise, a quick update.